Thank you, President or Mary, as I know you by, for that generous introduction. And good afternoon, and thanks you to ARP and its Divided We Fall partners for inviting me today. I also want to thank every one of you for caring enough about healthcare in this country to take the time to join us this afternoon. We have a number of speakers and a lot of ground to cover, so I'll be brief. As Elizabeth Taylor said to her 8th husband, I won't keep you long. Let me just say that as a member of the Republican Healthcare Solutions Task Force, I do understand how big the challenges facing our healthcare system are today. Most importantly, too few Americans have access to healthcare, and many more are underinsured or cannot afford to get the care that they need. And that's why I think I was the very first member of Congress to sign on to ARP's Divided We Fall campaign. And I've always believed that successful healthcare reform will have to be bipartisan, as Mary mentioned. It's so important, and include input from both sides of the aisle. What I liked about the Pledge of Principles is that it focuses on the positive, what we can agree on, and not on a list of things that we cannot or do not accept. So in that spirit, I am hopeful that President Obama and members of the other side of the aisle in Congress will actually work with us when they introduce comprehensive health reform later this year. If not, you can be sure that I will evaluate the proposal carefully when it is released. And in the meantime, let me give you my outline for what I believe that should be included in a health care reform package. First, though, let us start with who is uninsured. Like me, I'm sure you've heard widely varying accounts about how many Americans are without health insurance each year. According to the Kaiser Family Foundation, 45 million Americans were uninsured as of 2007. And of these 45 million, I'm hearing 50 million now this year, so it keeps growing. But 9.7 million were illegal immigrants. 11 million were eligible for government-funded health care but hadn't yet been enrolled. 99.1 million have a household income of greater than $75,000. In other words, they can't afford to purchase health care, but for some reason chose not to. So then excluding the 4.7 million individuals who are in college, we have 13 million to 16 million Americans who remain uninsured completely. While there is, that number is certainly more manageable, it is still too huge. And even those who continue to have health care coverage are facing skyrocketing premiums and deductibles. So what should we include in a reform package? First is access. Health insurance should be available to all Americans who want to purchase it, and no one should be denied coverage based on income or pre-existing conditions. We also need to make sure that all Americans are educated about the healthcare options available to them. Of the 45 million uninsured Americans, nearly a quarter of them are eligible for either Medicaid or S-CHIP, that's the children's health care insurance, but are simply not enrolled. We must ensure that states use increased federal dollars to enroll the most vulnerable populations in these important programs first. And second is affordability. In 2008, healthcare costs rose at twice the rate of inflation. If we are to make healthcare available to everyone, it's going to have to be more affordable. And I've supported a number of proposals that would do just that. Associated health plans, which would allow small businesses to band together to purchase health insurance and would use the power of risk pooling to help small businesses get the same coverage that's available to the large corporations. And I'm sure that our friends at NFIB would be happy to elaborate more on AHPs and their importance to small businesses. I also support medical malpractice reform, which would eliminate frivolous lawsuits and that really drive up doctors' insurance premiums and the health care cost of all Americans. That's, for example, the doctors want to make sure that they give every test available. If you've got a cough, they'll say, it used to be you take 2 aspirin and go to bed. Now it's, we better do an MRI and all these other things to ensure that they don't get sued. Another important aspect is health information technology, which promises to bring down costs by reducing unnecessary paperwork and administrative effort in processing health records. And it would also allow doctors to better coordinate treatment and reduce mistakes, ensuring improved outcomes at lower costs. I know, if you're like me, every time you go to the doctors and they say, well, here's the sheet to fill out, you think, well, now, when did I break that ankle? Was that 15 years ago, or was that 20 years ago? This would all be taken care of by that. But one of the major issues that I've been trying to address for the last few Congresses is waste, fraud, and abuse in the Medicare program. And when I first looked at this issue, I found a story about a provider who had been billing from an address that would have put their company on a runway in the middle of Miami International Airport. I think that would have been kind of hard to do, or rather dangerous. But if this is the kind of abuse in the Medicare billing program, substantially more abuse certainly is occurring under the radar. So that's why I introduced HR 2027, which is the Medicare Waste, Fraud, and Abuse Prevention Enforcement Act of 2009, which would strengthen the program's enrollment process for providers, expand certain standards of participation, and reduce erroneous payments. Such simple steps as a background check to provide more affordable prescriptions and doctor visits for our seniors could really eliminate so much cost. So finally, all Americans should have a real choice in their healthcare decisions, and this means ensuring that all healthcare decisions are made by a patient and a doctor of their choice, not some bureaucrat in Washington. One of my concerns with this so-called stimulus package was its focus on what we call comparative effective research. While I strongly support increased research into effective healthcare treatments, the original budget saw comparative effectiveness research as a way to reduce costs by limiting available care. And what that just meant was that the medical decisions would be made by somebody in Washington rather than you and your doctor. I believe that all Americans should have access to the most effective treatment options available, not just the ones that are preferred by the government. Real choice also means that you should have the right to select the health plan that best suits your needs. Unfortunately, the government-run health insurance programs being proposed would likely drive out all other insurers out of the business and limit your options. If some on the other side of the aisle truly want to ensure that Americans can keep their health plans if they like them, then they cannot create a government-run program that puts those insurance programs out of business. As the debate on healthcare reform goes forward, I look forward to working with you and hearing your suggestions, and this is a great forum for that, to ensure that all Americans have access to the most affordable and effective healthcare available. So with that, I'll end my filibuster, and thank you again for inviting me to address you.